True sciatica is often confused with that generated by trigger points. Obviously, in cases of sciatica generated by trigger points in the gluteus medius, minimus, and piriformis, the symptoms of neuropathy are not present. Therefore, if the sciatica is due to trigger points, we do not have reflex alterations, for example, nor loss of strength, nor changes in feeling. We only have the typical pain radiation, which can be easily identified through trigger points. To locate these muscles, we first identify the iliac crest. We know this is the patient's iliac crest, and we also know that the gluteus medius originates from the iliac crest and inserts into the greater trochanter, while the gluteus minimus originates slightly lower than the gluteus medius, a bit deeper in the posterior iliac fossa. It inserts into the greater trochanter as well. Once we have identified the area between the iliac crest and the greater trochanter, we can establish our action zone. In this zone, we will have the gluteus medius and minimus. At this point, once the area is found, we can ask the patient to perform hip abduction, meaning to lift the leg. While resisting with one hand, we can palpate the contraction of the gluteus medius and minimus, because both of these muscles are abductors. At this stage, we ensure the patient is comfortable and use both fingers to locate the tense parts of these muscles. Once we find the tight area, which may correspond to the pain referred by the patient right at the moment of our palpation, we locate the tightest part that corresponds to the trigger point. Once we find the trigger point, as in this case, we ask the patient, is there radiation going down the leg? If the radiation is typical of the sciatica described by the patient, we can be fairly certain we have identified a trigger point for sciatica. We can choose to apply pressure on the trigger point in various ways, using our thumbs or fingers, and we maintain it for about 90 seconds or until we feel the muscle give under our finger.